I am Professor Dr. Vivek Gupta, Senior Cardiologist in Delhi Apollo Hospital. I have been working with Apollo Hospital, New Delhi for the last 25 years. Before that, I was working in France, the most famous cardiologist of the world with Professor Alain Cribier in Hospital Charles Nicolle in Rouen, 1996 to 98. I have been having a very good special relationship with the father of TAVI, so-called father of TAVI, Professor Dr. Alain Cribier. So I would like to talk about his innovation, which is transcatheter aortic valve implantation. And this innovation is very important for the overall health care. Why? Aortic valve stenosis is a degenerative disease which is causing many deaths in elderly population. Many deaths. Very important. So let me tell you that heart diseases are basically 3 or 4 types. One is, of course, we all know about angina, we all know about heart attack, which is because of the blockage in the coronary arteries. We have been talking a lot about this, but today I would like to talk about another disease, which is aortic valve stenosis. Heart has got 4 valves: aortic valve, mitral valve, pulmonary valve, and tricuspid valve. Which is the most important 2 valves are mitral valve and aortic valve. Aortic valve, through the aortic valve, there is a huge blood which goes from the heart and supplied to the whole body. And this is very important valve. In elderly population, especially after the age of 70, since the lifespan is growing up, more and more people are living beyond 70 years. There is a degeneration in the valve, and which leads to blockages or stenosis in the valve. Till few years back, the only treatment of aortic valve stenosis was surgical aortic valve replacement. Surgical aortic valve replacement is a good technique, but it is prohibited in the patients who have got many other illnesses. For example, the patient has kidney disease, or the patient has got some other previous bypass surgery, or the patient has got poor heart functions. In these patients, the aortic valve surgery is more dangerous and highly risky. Dr. Alain Cribier devised a technology where you can replace the valve, or rather you can put a new valve without opening the chest. And this is known as transcatheter aortic valve implantation. The first case was done in April 2022 in Charles Nicolle Hospital. That is why Professor Alain Cribier is known as father of TAVI. This is a balloon expandable device which is inserted from the groin. Groin means femoral artery, just like a stent. You all know that stent is done through the groin or through the radial artery, and it goes inside the coronary artery. But this valve goes from the femoral artery and goes inside the aortic valve in a diseased aortic valve, where a new valve is put without opening the chest. The most important beautiful part of this technology is that this is done without opening the chest, and that is why this is known as transcatheter aortic valve implantation. So till now, from 2002 to 2023, in about 21 years, more than 5 lakh surgeries or such operations have been done worldwide. This is a very important life-saving procedure, and therefore all the physicians, I again repeat, all the physicians should know about this technology, because this technology is available in most of the heart hospitals, including in the Apollo Hospital in New Delhi. And this technology here, the patient is safe, is discharged in 2 to 3 days time, and sometime in 2 days, and the patient is of course walking the next day, or sometime the same day, of course the next day. So this technology, I would like that all the physicians should know about this, and they should be able to at least refer these patients and let the patient know that there is a treatment, because many patients, when they are refused by the surgeons, at that time they continue on medicines only. And when, I tell you again, very important, when the patient of aortic valve stenosis, severe aortic valve stenosis, is not given the opportunity for the valve change, either by TAVI, transcatheter aortic valve implantation, or by surgery, they have a limited life. they can have sudden death, they can have a heart failure, and they can come on ventilator. The overall lifespan is reduced, I tell you again, is reduced once the patient is diagnosed with severe aortic valve stenosis. So I tell all my family physicians, all the GPs, general practitioners, all the MBBS doctors, all MD doctors, all DM doctors should know about this technology, and they give the patient the correct advice that this technology can also be useful, in fact more useful in patient saving lives in the patient of aortic valve stenosis. Thank you very much. I am Professor Dr. Vivek Gupta from Delhi Apollo Hospital talking about transcatheter aortic valve implantation, which is TAVI. Thank you.